Yep.
Hello, welcome back to the channel today. It's Dr. Gallimore here with 10 Minutes with a Doctor. I'm joined by Laura Elliott, who's our IT manager here at the Courtside Surgery, and today we thought we'd bring you an eConsult special. There's been a number of changes at the surgery recently, really championing eConsult, and we just wanted to, me and Laura today, go through why that is and some questions that have arisen from the initial introduction of it as being one of our mainstreams of contacting the surgery. So just to start with, in context, the e-consultation has always been a tool that we've had, but from the 10th of March, we've now been championing it as our primary mode of contact in the surgery. And the rationale for that being is that we feel that it provides a better access point for our patients and sort of equity in regards to the resources and appointments that are available for our patients. And even though we're still in the infancy of using that as well, the feedback in regards to people using the e-consultation has been very positive, and we're quite excited about it moving forward. So today, really, what I want to do is just introduce Laura. She's going to say a little bit to start with about the e-consultations, and then I've got some questions to ask her as we go along. So I hope you guys find this useful. So over to you, Laura.
Thank you, Dr. Gallimore. As you mentioned, eConsult is the primary contact for contacting the primary method for contacting the practice for pretty much everything. So whatever you would have done on a phone, you can now do via eConsult. So that's a request an appointment, request a letter, sick notes. It's pretty much it can do all of that, and it's not only for medical advice. It's not only children, but adults as well.
Yeah.
So the only exception to that is still the prescribing, which has its own avenues. So you have the prescribing line and the email. So for prescription requests, please put them in as normal. Sort of really, we're trying to keep the eConsult for medical and admin side. The good thing about the eConsult is it offers so much flexibility, and it's almost, the way I think of it is it's like a call. So when we introduced our phone system in October, we had a callback system on the phone. This is essentially a callback system for medical advice.
Yeah.
So, and it's a lot more flexible. So the eConsult isn't limited till from the 8:30 to 6:30. There is limits in the week when you can request an eConsult, so we have changed that slightly. But the hours that you can request an eConsult, so going from Sunday morning as a starting point of the week. So from Sunday morning, it's open from 9 a.m. through to Monday night at 9 p.m. Tuesday to Thursdays, it's 7 a.m. to 9 p.m. and Fridays between 7 a.m. and 6:30 p.m. The service is shut on a Saturday, but that does offer flexibility for workers if they need to request anything outside of their normal hours, and you're not sitting on the phone for hours. So we have noticed that reduction in calls, which is hopefully meaning the line is freed up, the phone lines are freed up for people that need assistance with the eConsult service.
Yeah, so it sounds like we can still call into the surgery.
Oh yeah, absolutely. I mean, we have had that query. I think some patients have thought we've just pulled out our phone system and got rid of it. Yeah, but absolutely, we haven't. So we understand that in this world of where everything is so much tech driven, that there is more push to use on online services, online banking, and so forth. But we are aware that there are limitations to that, and people may not have the resources to be able to do that, which is why we still have a phone system. So if you can't submit an eConsult, then we do have all of our trained care navigators on the phone, still available on the end of the line, but they will just ask you a similar set of questions and complete the eConsult on your behalf.
Yeah, which is really important. It adds that flexibility. And I think you've rightly said as well, it's embracing the technology, but also just to highlight as well that as a surgery, this is something we've embraced, but as a national entity as well, the government is really pushing all general practice to really be embracing methods of contacting the surgery, certainly to triage for appointments, triage people's problems, and this avenue provides a really great tool for us to do that. So not only is it something we think will benefit us at the surgery, but you as the patients, it is actually something that's contractually coming in as well. So we are obliged to do it. So having a good system is what we're aiming for. So yeah, as you said, they can still call into the surgery, but if they complete an e-consultation, how quickly will they expect to receive a response once they've completed?
Well, I mean, in terms of initial response, if you submit it online and give us your email address, you will get an initial sort of just an automated response. But in terms of us get in contact with you, it depends on what you're requesting for. So obviously through the eConsult we can deal with children's medical problems as long as they're children over the age of 6 months.
Okay.
If you've got a child that's under 6 months, you still have to phone the practice and request an appointment over the phone.
Yeah.
So generally in terms of response times, because of the paediatric element, any paediatric request should be dealt with that same day or within 24 hours. For any adult medical issues, either same day or next working day. And because the admin is a little bit, less, still important, but it doesn't have the same time frame. You're looking between 2 to 3 days.
Yeah, so to clarify that, obviously, children's problems triage and should at least get a response about the triage within that sort of 24-hour period. Medical problems for adults and an actual outcome within 40 hours, and then admin 72 hours. Now, depending on the problem, that might not necessarily mean an appointment within that time, but you will certainly get a response and acknowledgement of the outcome of your e-consultation in that time frame. And as I say, we have a designated team clinically and our admin staff who are triaging all the time so that appointments are booked in the appropriate fashion. So if it does require an appointment that day, we would hope to facilitate that. But those are definitely the response times that we're aiming for. And
responses can come, obviously, there may be text message, email, or you might get a call from us. So it'd be all very
all of those. And I think you can, as you say, on that e-consultation, specify which one you would preferably want the surgery to respond on your behalf. So just be wary that if you have done that, the practice will absolutely try to either text you if that's what you've wanted, email you if that's what you've wanted, or if you don't have any of those avenues, we can still give you a call as well. So with it being introduced fairly recently, and we're several weeks down the line, have there been any sort of themes or queries that you've picked up as we've been developing that have come out from us instigating this?
Yeah, there has been many. As I said, the first call, the first issue really that was risen, which we touched on earlier, was the fact that people concerned they still can't phone us, which as per my earlier response, you can. I mean, as we are trying to push eConsult as much as possible, so because if we get everybody to use it, it gives us that ability that we can triage and look at everybody's responses the same way. So where if a patient physically can't do an e-consult themselves, we do advise and strongly recommend that they speak to a relative, friend, neighbour, anybody with that internet access that can do it on their behalf. But as I said, our team is on the end of the phone dealing with the queries if you need help filling it in. The other thing that arose initially, and it kind of has settled a bit, but I still got the odd query, is about when people put in medical request for medical advice, is the symptoms. So when you go onto eConsult, you'll be presented with a list of symptoms. And it's an A to Z list. So all I've been suggesting that patients do is you've got to think of your symptom in a bit more of a broader scope. Because there might be things like knee pain, neck pain, abdominal pain. So you have to kind of put it under that generic category. Once you're in the questionnaire, you can put as much information about your symptoms as you can, but just on the initial request, you've just got to put it under one of those broader categories. There is also, if you can't find a medical symptom that fits your what you're inquiring about, there is also a general advice category. And right at the bottom, if you scroll down the A to Z list, is another category. You do also have a search box at the top of the screen. So instead of you scrolling down quite a long A to Z list, use a search category and it'll help you get to your symptoms a lot faster and just speed up the process, because it can seem very daunting, the amount of information that an e-consult can ask for. And that's just, this is just before you even get to the questionnaire part.
Yeah, and I guess going to the questionnaire part, what kind of questions is the consultation really sort of asking?
Well, it depends. They're all tailored to what you're requesting about. I mean, taking from an admin request, you might only get 2 or 3 questions.
Yeah.
But in terms of the medical questions you get, it's sort of a basic set of questions, but then you'll get questions that will branch off depending on how a patient answers the questionnaire. And I mean, another comment I've had is that patients seem to be getting questions that don't seem to be relevant to what their medical inquiry is.
Right. Okay.
I would say, even though they might seem a bit odd or not relevant, please complete them, because all that information is really, really useful to the clinicians and to the surgery. So even though it might seem odd, please complete it. And on some of the questionnaires, you might get requests for optional questions.
Yeah.
Again, please complete as much as you can, because it is all relevant.
Yeah, and I would certainly second what Laura's saying there as a clinician as well. The more detail that you guys can put into an e-consultation allows us here at the surgery to make the best informed decision that we can. If we have very little clinical information, it's really hard for us to be able to make an appropriate decision on that. So the more that you can fill in, the more that you can be open either on the e-consultation or the e-consult light that the girls might be doing at the desk if you call in, it just provides us with enough information that we can triage you at the surgery appropriately, get to the right resources most appropriately. So the effort you put in to put in the information there does pay dividends in regards to how well then we can triage and get you the most effective outcome from that as well. So absolutely, even if questions don't appear relevant, please just stick with it and keep to them, because I say it is all useful information.
And that outcome may even be that they can deal with, clinicians might be able to deal with the problem without patient even stepping foot in the surgery.
Absolutely.
So as I said, information is king here.
Yeah, absolutely. And that's, I'd say it's all about trying to navigate you guys through the surgery with the resources that we have. And this is what we feel is an effective tool. And for it to be as effective as possible, if you guys can engage and put in as much information into that, it does make the process a lot more efficient and a lot easier and ultimately better for you guys as well. Was there any other sort of, from your experience from being on the ground and seeing, was there any other sort of queries or questions, or you think anything that patients might want to know about in regards to the process?
Other than simple questions like, where do I find the eConsult? That is, there'll be in the description of this video will be a link to a website. On the homepage, if you scroll down about halfway, there's a blue box that says get advice from your doctor. It's that blue box, which will then lead you to which will lead you to 4 options. That's medical advice for adults, for children, administrative requests, and you can also put in long-term conditions. So you may be required for reception reviews, HRT, blood pressure, things like that. But that's where you'd find that's sort of the gateway.
Okay.
The other thing I got queried about was, before you even start an eConsult, you're presented with 2 options, and this confuses some patients. So those 2 options, it gives you either option to log in with your NHS login, or I said just continue without logging in. Yeah. All that does is, so your NHS login would be, if you've got the NHS app, it's that same login.
Okay.
The only benefit logging in with your NHS account gives you is that it will autofill all your contact information, because it's got that on record.
Right. Okay.
Whereas if you don't, you just spend a few minutes more filling in your name, address, date of birth, contact details. So you do get some benefit by logging in with the NHS account, but it is marginal.
Right, so it sounds like there's either option there really as well. Okay, all right. And if I'd say, because we appreciate this is an ongoing process, there'll be things that are always coming up and patients will be coming into problems potentially, or questions they may have. Where else can they go now to get further advice if there's nothing that, for example, we haven't covered in this video that helps?
Well, further advice, there'll be, again, look in the description of this video. That I'm going to post some links to guides, to leaflets, things that may help you, like a step-by-step walkthrough. Also, for a while now, myself and my IT colleagues and a couple of the other staff have been running IT help desks.
Yeah.
This was initially for the NHS app, and we still want people to come in about the NHS app, but also now this involves eConsult as well.
Yeah.
So if you're stuck, if you have a question, if you want a guided walkthrough, please ask at reception. Previously, these IT help desks were walk-ins, but they have gotten incredibly popular now, with people wanting our advice and our help, that they are bookable now. So if you are interested in coming to one of our help desks, please speak to the reception team or pop in and ask at the desk. They will be able to give you the next dates and times available that you can have a dedicated 15-20 minutes with one of us, one-on-one time, sort of, and we can help you with any problems you may have.
Yeah, and I can't really strongly encourage that as well. The IT team and Laura and everyone have done such an amazing job, and actually these workshops have been really positively received as well. People who thought that they just couldn't engage with this type of process before have been shown, gone through any of the concerns they have, and have now become really effective users of things like the eConsult and the NHS app, which has really aided their access to the surgery. So absolutely, if you've got any concerns or apprehensions, please speak to the front desk and you can get booked in for some of these as well. So really appreciate your time today, Laura. As I say, Laura and the team have worked really hard in there. As I say, just as a doctor here at the surgery as well, we do generally feel at the surgery that the use of this as a platform and a primary mode of contact surgery is going to benefit all of our patients at the surgery in regards to access to the resources that we have available to us here at the surgery. So, as I say, it's in its infancy, but it is continuing and we're getting positive feedback. So we have every expectation that will continue. So thank you for your time today. If you have a moment, please sort of click and subscribe. We do post videos sort of semi-regularly updating you on things and big things like, for example, the e-consultation as well. And also you'll get notifications like in the description below about the other information that Laura's mentioned as well. So thanks very much for your time today.